Hi, I'm Selena and I'm from Pain-Free Physiotherapy and Align Health. Do you feel like your shoulder wants to pop out at a certain position? Do you find your shoulder unstable when you try to throw a basketball or when you try to spike a volleyball? If yes, this video is for you. Today, I'm going to talk to you about shoulder instability. Shoulder instability refers to the inability to maintain the head of humerus, which is our arm bone here, within the glenoid fossa, which is the space here as you can see. Normally, the ligaments and the muscles around the shoulder joint should be able to provide a balanced net muscle force to stabilize the shoulder. However, if the integrity of the structures are disrupted, it's very likely that it can lead to shoulder instability. To understand how muscle imbalance causes shoulder instability, let me tell you how the muscles normally work first. This is the scapula, our shoulder blade. This is the humerus, our arm bone, and this is a muscle called deltoid. Due to its attachment, it can produce forces with force vectors pointing up and to the front. Whereas at the same time, in normal situation, the rotator cuff muscles, indicated here in blue, should be also working counteractively to produce a downward and backward force to stabilize the shoulder. If one muscle out of the two get tight, the imbalance in muscle forces will be causing a faulty position of the head of humerus. This type of shoulder muscle disruption will always cause three problems. 1. Instability. 2. Impingement, and 3. Tendinopathy. Depends on the patients and the type of the muscle imbalance. They could present with one symptom more than the other. If the patient's presentation relates more to the excessive movement of the head of humerus, then we call it a shoulder instability. People with shoulder instability will present with common symptoms such as pain during activities, especially overhead activities, loss in range of motion, and even swelling. Your doctor may get you to get some sort of imaging, such as ultrasound or MRI, and in most cases, those images will show some tearing of the structures around your shoulder joint. From that, they will then assume you have inflammation, then will prescribe you with some anti-inflammatory or pain medications. Some doctors will prescribe you with some general shoulder exercises. However, doctors are not trained to prescribe exercises, so the exercises that they prescribe do not always address the root cause. For us, we don't look at shoulder instability locally, just at the shoulder area. At Pain-Free Physio, we use a holistic approach to assess our body as a whole to identify and treat all the possible contributing factors that lead to your signs and symptoms. We'll do a head-to-toe examination to find all the possible contributing factors. Most of the time, we find that the cause of your shoulder pain is actually not in the shoulder, but in somewhere else. It can be in the deltoid, one of the muscles in front of your shoulder, in the neck, in your upper back, or even down onto your calf. If we treat the real cause, we can get immediate, significant, and long-lasting effect. Depends on what we find in the assessment, we can provide you with advice and educations on activity modifications, apply manual therapy for immediate relief, and teach you a home exercise to help addressing the underlying causes. Well, depends on the primary cause of your problem, we can give you different home exercises. Let's say, if we find that your head of humerus, which is your arm bone here, tends to pop forward during this movement, we can teach you an exercise to do at home to help improve that muscle control during the movement. Let me show you how.
Have the patient lie on the back, bring the arm out to just short of 90 degrees, if the patient is able to assume this position. So in this position, you want the client to rotate the arm in that direction and then come back to the middle. It's like you drawing an arc, a circle, with the tip of the elbow as the center, but you don't want the center to move. The client will need to gently pull the shoulder back by a little bit, just a tiny little bit, that's it. Just hold it there and then rotate the arm, keeping the center still. The therapist monitor the humeral head here, make sure the shoulder does not pop forward. So you can go into that direction, external rotation, and you can do the same for internal rotation.
Whereas if we found that the primary cause of the shoulder instability is the over-forwardly positioned shoulder blade due to the inactivation of one of the muscles at our back, the lower trap, we can teach you a home exercise to help retrain that muscle.
So can you imagine your arm bone going backwards towards the wall behind you? That's it. Good. Okay. And then this time, drawing your shoulder blades down towards. That's it. Okay. Holding it here for about 5 seconds. Okay. 1, 2, 3, 4, 5. Good. And relax for me. Okay.
So if you suspect you have shoulder instability, feel free to talk to us and we'll be happy to answer your questions and tell you what we can do to help.